Hi, this is Tom Charlton. I'm the Regional Director of EMS for U.S. Acute Care Solutions here in the Cincinnati market, and I'm also an EMS Medical Director for several of the agencies in the area. Today we're going to be talking about the Moderna COVID vaccine and how we're going to go about immunizing each other. Moderna is the vaccine that is being provided to us by the state of Ohio and is what's going to be administered to most of the firefighters in the state, along with most healthcare providers. There's also another vaccine on the market, the Pfizer BioNTech vaccine, that is also being used. However, it's primarily being used at several of the larger hospitals and then also at nursing homes and congregate care settings. I don't have any disclosures. I'm not being paid by any of the manufacturers, etc. So I do have some disclaimers. I'm not providing any kind of medical advice specific to a patient. This is all generic training material. If you have any questions regarding whether you should be vaccinated, you need to talk to your regular doctors, and that includes questions about whether or not you should be vaccinated, can be vaccinated, etc. The information provided here is consistent with the emergency use authorization granted to the Moderna COVID vaccine. So this vaccine is supplied as a suspension for intramuscular injection. It's going to be given as a series of 2 doses, each of them about 0.5 milliliter, 1 month apart. There's no data that exists on whether it's safe or effective to get, say, the Moderna vaccine for your first dose and then the Pfizer vaccine for your second dose. We just simply don't have any data on whether that's safe or effective. Essentially, the guidance is if you get the Moderna vaccine for your first shot, that's what you get for your second shot. There is some storage and handling requirements. Luckily, this particular vaccine is much easier to handle and store than the Pfizer vaccine. The vaccine comes as multiple dose vials. There are roughly 10 doses per vial. For long-term storage, it needs to be stored frozen between negative 25 degrees Celsius to negative 15 degrees Celsius. They specifically say do not store on dry ice or below negative 40 degrees Celsius. The vials can then be refrigerated between 2 degrees Celsius to 8 degrees Celsius for up to 30 days prior to its first use. However, once it is punctured, it really can only be stored for up to 12 hours. Unpunctured vials can be stored between 8 degrees Celsius to 25 degrees Celsius for up to 12 hours. And do not refreeze these once they're thawed. Once it's punctured, once it's thawed, your clock is really ticking. After the first dose has been withdrawn from the vial should be held between 2 degrees to 25 degrees Celsius. And you've got to discard any punctured vial after 6 hours. And again, do not refreeze these. Any vaccine that gets refrozen is likely not going to be effective. So to prepare for this, you've got to remove the required number of vials from storage. Thaw it in the refrigerator between 2 degrees Celsius to 8 degrees Celsius for 2.5 hours. After it's thawed, you let it stand at room temperature for 15 minutes before administering it. Alternatively, you can remove directly from frozen storage and thaw at room temperature for 1 hour. You then gently want to swirl the vial after thawing it and in between each vaccine withdrawal. Do not shake and do not dilute. The reason you have to swirl is to keep the lipids that are encapsulating the mRNA in suspension. And so this helps stir them up. But we do not want to shake them because we don't want to disrupt them. This is what the vaccine label itself looks like. Unfortunately, I was not able to find a picture of an actual vial yet, since this is such a new vaccine. It's going to be coming in these multi-dose vials with this label in place. It's an off-white to white type suspension, and it may contain some white or translucent particles. If you see anything else that's not white or translucent that's floating in there, you need to make sure you alert someone to it. So to administer it, you're going to visually inspect the vial and the dosing syringe. You're going to draw up 0.5 milliliter of the vaccine, and then inject it into the deltoid muscle using the standard intramuscular injection method. And what I mean by that is you're going to need to use the appropriate size syringe, the appropriate size needle, swab the area with an alcohol prep, let that alcohol prep dry completely, inject the area into the deltoid, and then apply a bandage over it. It's extremely important, since these are multiple dose vials, that you discard the needle and syringe between patients. We do not want you repuncturing that vial with a used needle, because then you've contaminated the entire rest of that vial. There really is only one major contraindication, and that's to not administer the vaccine to anyone with a history of severe allergic reactions, such as anaphylaxis, to any component of the Moderna COVID-19 vaccine. The Pfizer vaccine has had several cases of anaphylaxis associated with it. However, the patients were easily treated with standard anaphylaxis treatment, and as far as I'm aware, there were no significant problems with those patients. The most common adverse reactions are listed here. Again, the majority are going to have some sort of an injection site pain, fatigue, headache, myalgias, and then decreasing from there, some muscle aches and pains and joint pains, chills, nausea, vomiting. There were about 20% of patients reporting some sort of axillary swelling or tenderness, fever, swelling at the injection site, and erythema at the injection site. All of these tended to be extremely self-limited, usually disappearing within 24 hours of the vaccine, sometimes persisting out to 48 hours. Every person receiving the vaccine should be given the fact sheet for recipients and caregivers. Normally, you'd be getting a vaccine information sheet. However, again, this is not an approved vaccine. This is an emergency use authorization. As a result, there is no vaccine information sheet, or VIS. The link listed is where you can go and get the fact sheet for recipients and caregivers. It's also important that you provide a vaccine information card, which will be provided to you with the date that the person needs to have their second vaccination. The CDC is also developing this program called vSafe, which is a smartphone app to track any kind of adverse event, as well as give you reminders about when and where to get your vaccine. If you have any questions, make sure and talk to your training officer. I'm scheduled to get my Moderna vaccine on December 28th. I highly encourage you, if you're eligible, to get your vaccine as well. Also, it's important that you check with your training officer regarding any of the paperwork that's going to need to be filled out and the specifics of how your department is going to be running the clinic. Thanks, and look forward to getting my shot.